Let's begin our section on esophagus. In this section, we will be studying about the esophagus pathology. In this video, we will discuss the esophageal varices, Plummer Vinson syndrome, and GERD. And in later section, we will discuss achalasia, Barrett esophagus, and esophageal carcinoma. Let's begin our discussion with esophageal varices. Esophageal varices are dilated submucosal vein. You guys can see this dilated vein here. It represents the esophageal varices. The esophageal varices is common in alcoholic and may be a source of upper GI bleed. The most common location of esophageal varices in lower portion of esophagus, and it is produced secondary to portal hypertension. After the esophageal varices, the second topic is Plummer Vinson syndrome. The Plummer Vinson syndrome is a pre-malignant condition characterized by the formation of esophageal web. Esophageal web is a benign mucosal membrane that grows across inside of upper part of esophagus. For example, this is a esophagus. There will be a formation of benign membrane, and this will grow across and inside the esophagus. As a result of this, there will be a difficulty in swallowing of food, which can lead to dysphagia, and this esophageal mucosal membrane can rupture, leading to iron deficiency anemia. So the Plummer Vinson syndrome clinically will present with classical triad of esophageal web, dysphagia, and iron deficiency anemia. And as the Plummer Vinson syndrome is a pre-malignant condition, it increases the risk of squamous cell carcinoma of esophagus. The last topic is gastroesophageal reflux disease. The gastroesophageal reflux, commonly called as GERD, is a reflex of a gastric content into the esophagus due to the incompetent lower esophageal sphincter. Normally, the food passes from esophagus to stomach, and when the food passes, the lower esophageal sphincter contracts, and there will be no backflow of food from stomach to esophagus. But whenever a patient is addicted to alcohol, tobacco, or whether a patient is obese, pregnant, or having a disease scleroderma, all of these diseases will cause lowering of the lower esophageal sphincter tone. So whenever there is a decreased tone of lower esophageal sphincter, when there will be a reflex of a gastric content from stomach to esophagus. It is called as an gastroesophageal reflux disease, and as a result of this reflex, the patient can develop esophagitis, stricture, ulceration, or columnar metaplasia, called as Barrett esophagus. Gastroesophageal reflux disease is very troublesome for a patient, and the patient will experience heartburn and regurgitation when a patient lies down. To diagnose the gastroesophageal reflux disease, the investigation of choice is endoscopy. We perform endoscopy to check for the lower esophageal sphincter tone, and the most accurate investigation is 24-hour pH monitoring. We measure the pH of lower esophagus. Normally, the esophagus have normal pH, while the gastric content have an acidic pH. So if there is a reflex of a gastric content back into the esophagus will also have a acidic pH. So in this way, we diagnose the gastroesophageal reflux disease. So it was all about the esophageal varices, Plummer Vinson syndrome, and GERD.